Welcome to your guide to eyelid surgery. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. As people age, muscles weaken, skin stretches, and fat accumulates around the eyes, which causes the appearance of fatigue and stress. Eyelid surgery or blepharoplasty is one of the most popular facial cosmetic surgeries, helping more than 200,000 people a year regain a younger, firmer-looking eye area. The procedure can be performed on either the lower or upper eyelids, but many patients prefer to have surgery on both for a more balanced correction. Eyelid surgery is frequently combined with other facial procedures. Procedure: how will your eyelid surgery be performed? Surgery typically begins with incisions made along the crease of the upper eyelid and just below the lashes of the lower eyelid. When necessary, muscles may be trimmed or tightened and secured in a more youthful position. The skin is repositioned, trimmed of any excess, and stitched closed. Another common technique used to treat pockets of fat in the lower eyelid is called transconjunctival blepharoplasty. During this technique, a small incision is made inside the lower eyelid and fat is removed. This technique is usually used on patients without excess skin who only need fat removal from the lower eyelid. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation. Every person has a unique perspective on what may be the best shape for their eyes, and your goals will affect the way your eyelid surgery is performed. It is important to discuss your desires and to listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open, provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your eyelid surgery and for 1 week after surgery. Drink lots of water in the days leading up to your eyelid lift. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows and a bed wedge nearby so that you can keep your head elevated at all times. Recovery. You should expect some bruising and swelling for the first week or two. Stitches will come out or be absorbed on their own between 4 to 7 days. Your eyelids may feel tight or sore, but this is usually moderate. Pain medication will be prescribed to control any discomfort. However, if you begin to have severe pain, contact us immediately. The recovery process is different for everyone, but within a day of your eyelid surgery, you should be up and walking around. Keep your head elevated for 2 weeks following surgery. You may apply small ice packs during the first 24 hours to help reduce swelling and discomfort. For the first day or so, you may notice some tearing, light sensitivity, and blurred vision. You may also need to clean your eyes carefully for the first 2 weeks and keep your sutures free of blood and crust. Eye drops may be used if your eyes feel dry. You should be able to perform normal visual tasks like reading or watching TV soon after surgery, but should avoid wearing contacts until you are instructed to. For the first week, you should plan on being out of work and away from your usual activities. Following this period, you may gradually return to activities such as lifting, exercise, and sex. Avoid high-impact activities for about 1 month. Stay away from saunas for a few months as the steam can affect healing. Though the appearance of bruising will fade gradually, you may notice some remaining bruises for as long as a month after surgery. Therefore, you may want to consider using special camouflage makeup as you heal. These precautions will help you avoid stress to your scars and allow time for your facial tissues to heal and recover. Because the incisions used during surgery are small and hidden within the creases of your eyelids, any scarring is usually minimal or unnoticeable. The appearance of your eye area should improve over a period of several months. What are the risks of eyelid surgery? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Though blepharoplasty is a well-established surgical procedure, there are risks of complications. Just as in any operation, bleeding, infection, and scar formation can occur. Serious complications can include eyelid disorders, abnormal positioning, looseness or laxness of the eyelid, rolling of the eyelid outward, lid lag, and temporary vision problems. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your eyelid lift, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.